Good day, madam. I'm Sri Reddy Chandra. I'm from BPT 26B. Today, I'm going to talk about pressure ulcer. Pressure ulcer are also known as bed sores and decubitus ulcer, which are injuries to skin and underlying tissue resulting from prolonged pressure on the skin. Pressure ulcers form mainly on any skin that covers bony areas of the body. The common places for bed sores to develop including butt, tailbone, heels, ankles, hips, back, elbows, shoulder blades, and back of the head. Next is about the symptoms of the bed sore or the blood pressure ulcer. Warning signs of pressure ulcer are unusual changes in skin color or texture, swelling, pus blood draining, an area of skin that feels cooler or warmer to the touch than other areas, and lastly is tender areas. The next slide is about stages of pressure ulcer and the treatment. So, the pressure ulcer classified by four stages, which is stage 1, stage 2, stage 3, and stage 4. As for the stage 1, the first stage is the mild and affects the upper layer of the skin. In this stage, the wound has not opened yet. So the diagram shows the first stage of the pressure ulcer. As for the treatment, the first step is to treating a stage 1 bed sore is to remove pressure from the area. Any added or excess pressure can cause the ulcer to break through the skin surface. If you are lying down, adjust your position or use pillows and blankets as extra padding. It's also important to keep the affected area clean and dry to reduce tissue damage. Next is stage 2. In the second stage, the sore area of the skin has broken through the top layer of the skin and some layer below. The break typically creates a shower, which is open wound. So the diagram shows the stage 2 of the pressure ulcer. As for the treatment, it is similar to the treating stage 1, which is we should treat stage 2 sores by removing pressure from the wound, and we must seek medical attention for the proper treatment. Stage 3 is sores that have progressed to the third stage have broken completely through the top two layers of the skin and into the fatty tissue below. The diagram shows the stage 3 of the pressure ulcer. As for the treatment, we must seek immediate medical treatment if we have a stage 3 pressure ulcer. These sores need special attention. The last stage is stage 4, which is stage 4 pressure ulcer are most serious. These sores extend below the subcutaneous fat into deep tissues, including muscle, tendons, and ligaments. In most of cases, they can extend as far down as the cartilage or bone. There's a high risk of infection at this stage. As for the treatment, people with stage 4 pressure ulcers need to be taken to the hospital immediately. The doctor will likely recommend to the surgery. And these are the references that I get some information about the pressure ulcer. That's all from me. Thank you for listening, madam.